So how are you doing today?
I'm okay. My legs are still a little bit swollen and painful, and I'm tired, but I'm okay.
Okay, well, thank you for being here. I'm just gonna go ahead and check your vitals, heart rate, respiratory, blood pressure, oxygen, temperature. They all look good. Okay, for today, are you in any pain on a scale of 0 to 10, 0 being no pain, 10 is like really excruciating pain with your lower body?
Like a 4 out of 10. Not excruciating, but it's a little bit tight.
Okay. So we're gonna keep that in mind. I'm just gonna also assess your skin really quick. So just give me a second to just assess. Yeah, thank you. Just checking to see if there's any signs of infections. Have you noticed any infections or anything like that?
No.
Okay, let's make sure. Let's keep an eye out on that. As I mentioned last time, with lymphedema, you might have some cellulitis. So let's make sure we keep that in mind. Okay.
Okay.
Are you still getting assistance from your husband at home?
Yes, every day.
Okay, great. Just like also confirming from last time we did the assessment, the Canadian Occupational Measure of Performance, and that we agreed that your preferred occupations were focusing on dressing, sexual activity, and showering.
Yes.
Are those still like the ones that you want to focus on for therapy?
Those are my top 3 for sure.
Okay, great. So we will be practicing those today.
Okay, thank you.
How are the manual lymphatic drainage massages going at home?
They're really good. They feel really nice when my husband helps me do them. Okay. And then when he's not around, I'm able to do them myself too.
Okay. Can I have you bring your leg up one more time?
Yeah.
So I just want to make sure when you're doing the massages, are you going in circular motions?
Yeah, and I try to go gentle like you told me to.
Gentle. Okay, yes. We want to make sure we promote the blood flow with those. About how long are you doing the massages for?
For like 5 minutes on one of my legs and then 5 minutes on the other.
Okay, I think that works best. No more than 15 would be like that's plenty. So that's good that you're doing it. Are you doing it in the morning, the night?
I usually do them at night when my legs are the most swollen.
That's great. That's good that you're being aware of when the pain is happening. So you say it's more towards the night?
Yeah.
Okay, so it's good that you're aware of like when it occurs so that you can able to plan your occupations to schedule it before you get more fatigue. Okay, before we get into the interventions, any other questions that you have for me?
You mentioned the compression garments, and so I was just wanting to know more about those.
Yes, of course. So your doctor, did they prescribe those compression garments?
Yeah, my doctor said it would be great if I got some of those.
Okay, perfect. So we will show them to you later, but we will be able to put them on before you do dressing, and they also will help with that. With that promotion of the lymphatic flow, and that you just basically put them on before you do dressing.
Okay. And can I wear them during sexual activity too?
Yeah, of course you can.
Okay. Awesome.
Yes, not during showering. We'll take them off to shower.
That makes sense. Okay. Thank you so much.
Thank you.
Hello, my name is Arlene Gutierrez. Can I get your guys' name and date of birth?
Elisa Ornelas, 10-96.
Perfect. I'm in the right room with the right patient. And I assume that this is your husband, correct?
Yes.
Perfect. It's so nice to meet you, Mr. Lopez.
Hi.
So, I see here that we're going to be talking about some sexual activity. I know you do have lower leg lymphedema, and I hear that this is probably an area that we want to work on. Can you give me a little bit of information on what you're looking for today?
Yeah, as you know, with lymphedema, it's hard for me I get fatigued quickly, and so like with sexual activity, I'm not able to do some of the positions because of just the pain that I have in my legs.
Okay. Yeah, that's definitely something that we can work on. I did bring in a brochure here today. I do want to start off this session with just educating you guys a bit on the type of equipment that we can use to modify your guys' home. Modifying your home is probably going to be your best case scenario. So on here, I do have a few of the products here in person. So we're going to be using some pillows of different sizes, as well as different type of firmness, as well as a wedge. We do also have some ankle straps on here that we can look into, as well as some websites for some toys that you guys can possibly explore. I'll let you guys take that home. If you're interested in any of that, also reach out to me. I'm more than happy to help you guys with that. So just getting started, is there any other area, Mr. Lopez, I would love to get you involved? Is there any other area besides what she already stated?
No, I just know that she gets really, it's hard for her to move around because it's so heavy for her, and she gets really tired, and yeah.
Okay. And I know that you are primary caretaker at home. So do you feel comfortable setting up and as well as helping her get in these positions?
Yeah, absolutely.
Yeah, that's great. Perfect. So if you don't mind, are you ready to kind of get into it? Perfect. So it's just starting off, I do want to start off with some pillows. So these pillows have different firmness as well as different sizes. You guys can go ahead and feel those out. Yeah, go ahead and see those out. And then this is also going to be a wedge that you guys can use. So we'll go ahead and I'll show you how these are going to be used in different positions.
Oh yeah.
So there are going to be 2 different positions that we're going to show you guys today. And I do want to get you into one to see if you prefer the pillow or the wedge.
Okay.
So they're going to be the modified doggy style as well as the modified missionary. The missionary is pretty simple. It doesn't involve these toys. You're at the edge of the bed, and then this is where the ankle straps can come into play, where you can suspend your leg if you do feel getting that kind of fatigue. But let's start off with this and see how you feel. Next session, you guys can let me know if you guys get to use these at home, and then we'll definitely look into the ankle strap for you, okay?
Okay.
So just starting off, Mr. Lopez, if you don't mind, go ahead and get this started. So your role here is just to position the bed for her, make sure that it's ready for her. So we can go ahead and place some pillows by where her head would be, and then the wedge is going to be directly placed right underneath your hips, okay?
Okay.
So if you don't mind getting into this position, I can provide you with any support. And I know that you are a modified assist, so if you do need any kind of help, let me or your husband know. Okay, so how does this feel for you?
Oh, this is nice.
Yeah. And Mr. Lopez, how easy was it for you to get into this position?
Super easy. I can do this.
Perfect. So do you see yourself using this at home?
Yeah, honestly,
Perfect.
yeah.
Okay, we can go ahead and get out of this.
Yeah, I felt supported. I feel like my legs were elevated.
Perfect. Yeah, that's
what
exactly.
yeah.
Take off that pressure off of your legs as well. So I really hope that you guys use these at home. My job for you guys is to practice this. Come back to me with any kind of feedback that you have. If you have any kind of pain, we can definitely work on that. Maybe getting this a little bit bigger, a little bit smaller, we can definitely modify that. Do you have any questions for me today?
No. Do they have any like different firmness for
Oh
those?
yes, they do. Yeah, we can
okay.
definitely look into that for you. I did provide some more information on that all on the handout. Once again, if you guys have any questions, don't bother to call me. Reach out to us. And that's all for today.
Thank
Thank
you.
you.
Thank you.
Hi, Miss Lopez. My name is Ariana. Today we'll be doing showering. So I just want to go ahead and demo it for you really quickly. We'll stand in front of the tub bench. Once we're here, we're going to scoop all the way forward. Using our arms, we'll twist and bring our legs inside of the tub. Now, the reason why we're using a tub bench today is because you have lower body lymphedema. I know you really get tired, and I know that showering can take a toll on your body. So that's why we will be using a tub bench today.
Okay.
And yeah, so let's go ahead and let's get started.
Okay.
So go ahead.
Here. It's not gonna wet my hair, is it? I just got it done.
I promise you will not wet your hair.
Okay, perfect.
All right.
So scoop back.
Yes. So all the way back. Use your arms to twist.
Oh, this is comfortable.
Great, I'm glad.
Nice.
Okay, so right in front of you, this is shower head, and this is really beneficial for you to be able to get into all those areas that are really hard to reach.
Yeah, it seems very nice.
And one thing that we can adjust to just protect your skin barrier is we can adjust the temperature. So I can get a Sharpie and we can just mark what temperature feels the most comfortable for you.
Okay.
And then this is a long handled sponge that we will be using today. So we will be using special soap to make sure we protect the integrity of your skin. So if you want to go ahead and give that a shot of how you would.
With the soap.
Yes, and please massage gently.
Gotta get my toes.
Yes.
Got it.
How does it feel reaching forward? Is it easier?
It's pretty easy, yeah.
Yeah? Okay.
Yeah. My skin's a little dry, so I think this would help me a lot.
Awesome.
This is nice.
Just to recap, today we went over showering, and we'll be using adaptive equipment like the long-handled sponge and the shower head. Do you have any questions for me?
No, I don't actually.
And how do you feel doing this at home? Do you feel comfortable, like you're capable of doing this on your own?
Yeah, I think this would make my showering a lot easier.
Awesome, I'm really glad to hear that. Well, thank you. I'll see you next time.
Perfect. Hi, Mrs. Lopez. My name is Faith. I'm going to be your occupational therapist today, and today we're going to go over lower body dressing.
Okay.
I know that you have some lymphedema in both your legs. How is that going for you today?
Today I'm in a lot of pain.
A lot of pain?
And I'm really tired.
Really tired. Okay, well, we're going to use some techniques, to energy conserving techniques, and to make things easier for you. Okay? I know Mr. Lopez is your caretaker, and he's been helping out throughout your process, so that's awesome. And previously mentioned that you can do some compression garment wrapping, and we can address that today.
Okay.
But first, we're going to learn how to do dressing. Okay, so these will be your pants. I'm just going to show you this little gizmo. It's called a long hand a reacher.
Oh, okay.
And what you can do with this is like reach from a distance, so you don't have to bend over, because I know that you have some lymphedema right in the hip area too. Okay, so first I want you to have the strings or anything in the front of the pants up. I will say use loose fitted clothing because you don't know how your edema is going to be that day.
Okay.
And then the tag's going to be where your legs are, okay?
Okay.
And then I'm going to have you scrunch up one leg at a time. It doesn't matter which leg since both legs are affected. And then once you get all the scrunching up in one leg, you can use your long-handled reacher. And you can just push down here to use the grab thing. And then you can grab it. And then you're going to like fish your leg through. And then you can pull it all the way up, okay?
Okay.
So I'll have you practice.
So I just thread it just like this?
Yeah, just thread it all the way up. Very good. Okay. And then here's that reacher so you can get used to using it. Yeah. And then I'll give you some links so you can buy one of these for yourself. They have good quality ones.
Oh, wow.
Awesome. Yeah, and you can just bring
That's
it all the way
really
up with
easy.
your hands. And you can go ahead and do the other side too.
Okay.
Very good. Alrighty. Let me help you with that. And you can have your husband help you with this too if you're having any issues. Alrighty. Okay, so the next thing is called a sock aid. So basically you're just gonna roll your socks up and have the front side of the sock facing up like this where the line is.
Okay.
And you can just fish it through. Oh my goodness. And and then you're gonna fish your foot through. Okay? And then you're gonna pull on these strings. I'll show you how to do that.
Okay. So I just put it on the floor?
Yep.
Okay.
Yep, just put it on the floor. Here, let me help you. And then you can put your foot through and then push your foot into the sock while pulling up. Very good.
Oh, that was so
Okay, I'll
easy.
give you this sock so you just roll it up onto the things. Amazing. And loosely fitted socks will be good too.
Okay.
Alrighty. Here's some shoes you can just slip on. Good. Alrighty, and then go ahead and stand when you have both shoes on. So you're safe.
Okay.
And pull those pants up. I'm holding you.
Okay.
Alrighty, and that's how you don your clothes.
Wow, thank you so much.
You're welcome.